Good evening to all the viewers who are watching live. Sorry for keeping you in this delay. We were facing some network issues, network challenges. So we have a very short time. So without wasting any more time, let's just go to the 30 seconds countdown time.
Good evening, sir. Good evening, everyone. This is 112th live online continued medical education program. And tonight, it's a very significant CME for all of us, those who are in love for NIH, those who had studied in NIH, and those who are still studying in NIH. Have our new director. Have Dr. Pralay Sharma with us in the studio. But before we bring on Dr. Pralay Sharma live, Director in charge, our beloved Dr. Pralay Sharma, with the permission of our beloved President Dr. Kalyani sir, on our inaugurator tonight.
Sure. Hello. Good evening, everybody. Hello, I am Dr. Tanmay Bhattacharyya from second batch of BHMS from N.H.M. in 1998, and I also known as Topu, name given by my senior. I am working at now Jhowdanga Gram Panchayat as a HMO, Ayush HMO under N.H.M. since 2014. I convey my gratitude to my respected seniors and teachers of our college and love to all my batchmates and juniors of N.I.M. I am grateful to all of my batchmates and juniors of N.I.M. I am grateful to inaugurate the CME program on 112 CME program today. Today, today's moderator Dr. Sujit Pal, the moderator Dr. Sujit Pal, Department of Repertory and Case Taking in Guru Mishri Homeopathic Medical College, Jalna, Maharashtra. He is also our batchmate. He is renowned professor in Repertory. He is working long days in Maharashtra. In the meantime, we have a great news for all of us of NIHians that Dr. Pralay Sharma, just our adjacent senior, Dr. Pralay Sharma, first batch of B.H.M.S, we get respected Dr. Pralay Sharma, now director among us today, the program. I am also requested to Dr. Pralay Sharma, director of NIH, for sharing his experiences to achieve the goal through long journey. And also after that, today's speaker is Dr. Zafar Imam. He is also from second batch, our batchmate. He is also very well-known physician in Kolkata who is practicing for more than 7 years. He has got many clinical experiences through his practices. Now, I am asking the moderator and the speaker to express their words or thoughts through this 112 CME program today. Please join. I requesting to join Dr. Polay Sharma, Director of NIH, to sharing his clinical experiences through it. Thank you, Dr. Polay. Welcome to Dr. Polay Sharma. Please join with us.
Thank you so much. Can I talk? Can I talk?
Yeah, audible now, clearly.
Respected Kalyani sir, very beloved Mukherjee, and on the dais, Dr. Tanmay Bhattacharyya. He happens to be inaugurated today, Dr. Tanmay Bhattacharya. Thank you so much, Tanmay, for your kind words and introduction. Although I am not supposed to talk on any subject today, my appearance here just to showcase my love and affection towards the Alumni Association. This is my very happy time to be on the dais. It is absolute honor for me to address you today as a director in charge of National Institute of Homeopathy. I would like to address in this special CME webinar organized by National Institute of Homeopathy Alumni Association. This moment holds a great significance as it brings together our esteemed alumni, our experience, and the professionals dedicated to the advancement of the homeopathy. Our alumni association has always played a role in fostering knowledge, exchange, and professional growth. Today's CME is another testament to our collective commitment towards continuous learning and improvement of homeopathy practice. I believe that this seminar will go well, and this seminar will give a significant insight in the subject of homeopathy. And I'm very happy that to be with you all ex-students of our institution, be it DPNH, be it MD, be it a BHMS. This is very happy moment for me to be with you today, this evening. I believe that this webinar will go well, and it will get a stand that whoever will watch in YouTube in your future will be benefited out of our this webinar. Thank you so much, our secretary, Dr. Bidyut Mukherjee, our president, Dr. Kalyani sir, Devnaran Kalyani sir, and today's speaker, Dr. Zafar Imam, and today's moderator, Dr. Sujit Pal, and inaugurator, of course, Dr. Tanmay Bhattacharya. And this is a unique combination that all of them, who are on the dais today, belongs to the second batch of BHMS, just in junior to our batch. I believe that the responsibility what you have given, which has been shouldered upon me, I can go ahead with your blessing and best wishes in the upcoming days with these few words, and I pray that you will all bless me to go to do a hard work for the development of the system as well as of National Institute of Homeopathy. Thank you so much, sir. Thank you everyone out here who are watching this webinar right now and who will be watching in future through the Facebook or the webinar. Thank you so much. Thank you very much for giving me a chance. Thank you so much.
Thank you so much, Dr. Sharma. It's a
Let
proud.
me add a little more. If I am permitted, I want to add a little more regarding Prolog.
Gee.
See, we
Yeah.
are so glad and so happy. I was just waiting for the moment that Dr. Prolog Sharma is no more Prolog or Prolog sir. Now he is director of NI. It's a great proud for all alumni. And you might be knowing that last alumni meet, he was elected as the best BHMS among the alumni of NI till date.
Thank
So
you,
our
sir.
election was so perfect that we elected a next director for whom any and every alumni are now free to come to NIH freely as their old home, most beloved home. It's a great pleasure
Exactly.
for all of us. God bless
Thank you.
him. All alumni are with you in
Jesus,
any
thank you so
time,
much, sir. Thank you,
during
sir.
pain and pleasure. Always will be with you.
Thank
Thank
you,
you
sir.
very much. Thank you
Thank
very
you.
much. God bless you.
Thank you, sir.
Kalyani sir and Dr. Sharma. Also, do we have with us Dr. Zafar Imam and Dr. Sujit Pal? Uh,
He is with,
I'm
they are
trying to
with
get
us.
in.
They are with
Also, do we
us.
have Dr. Sujit Pal and Dr. Zafar Imam
They are
with
with us.
us?
They are with us. They are with us.
Okay, please bring them to the studio and let's start the CME.
Yeah, I'll prefer to be on the backstage. Orko,
Okay.
I'll prefer to be on the backstage.
Okay.
Thank you for your presence, Dr. Sharma. We are honored to have you on screen tonight.
Surely.
Let's start 112 CME. Zafar, Dr. Zafar and Dr. Sujit.
Hello. Hello, Dr. Bidyut Mukherjee. Can you hear me?
We can hear you.
Can you?
Yes, yes, you are
We can.
audible.
I have a microphone
Continue.
problem, camera problem.
No problem.
I am hearing everything from the
Okay.
webinar, but unfortunately I cannot join. Why?
Okay. You just speak on the voice with the.
Okay, okay. I am starting.
Yeah, please, please.
First of all, I am giving my heartiest congratulations to Dr. Paula Sharma, the director of National Institute of Homeopathy. He is the very interesting person in our institute from the very beginning of the first batch of NIH. I am asking for the clinical experience regarding in my practice. So I wanted to give it my share my experience what I have known from the 26 year of my practice. First of all, I can say the honeyman remains one of the four epochal features in the history of the practice of medicine. Hippocrates the observer introduces the art of clinical observation as the necessary basis for pathological diagnosis. Galen, the disseminator, spread with powerful authority the teaching of Hippocrates over the medical world. Paracelsus, the SLR, introduced chemical as well as physical analysis into the practice of medicine. So the the therapeutical diagnosis and thereby made the practice of medicine make the scientific of homeopathy. I have lot of clinical experience regarding the on the treatment of the patient in my chamber. I am sharing one of these a case of allergic cough. 15-year-old boy was brought by his parent for allergic cough while he not responding previous homeopathic treatment taken over for 2 weeks. The rattling noise was evident. The rattling noise was evident, however, he was unable to spit out the phlegm.
He further mentioned that he coughs more when he goes to school in the morning and in the foggy weather. This mortality was further verified when explained that coughing worsened every alternate day. No other characteristic feature could be identified in this child. Both these marked symptoms were repertorized from Kent Repertory. One, loose expectoration without and fog aggravation. CPI is the only remedy, so I have given CPI 30 that help the younger child get rid of the cough in 3 days. Similarly, I have a number of kidney stone cases associated with excruciating pain. When kidney stone move around the urinary tract,
Sir, we are unable to hear
in the
you.
case
Yeah. Thank you, sir.
in the case of small to medium sized stones, medicine positively remove the kidney stone. The most widely prescribed homeopathic medicine for kidney stone is Barbaris vulgaris. I have already a lot of experience to give in Barbaris vulgaris to the patient and the kidney stone has been removed. Similarly, I have a alopecia areata that it is an autoimmune disease attacks your body hair follicles causing patchy hair loss. So lot of medicines are there, but lycopodium, carcinosin, tuberculinum, based on the clinical science and the totality of symptom and individualization according along with miasmatic analysis, I have given Visbeden 30. Visbeden 30 is a mineral list thermal springs of Wiesbaden, a city of Germany. Renowned its treatment therapeutic water. It is mostly used to treat the hair, skin, nail, and other diseases.
Hello, Zafar sir. You are not audible, sir. Maybe some technical issues. I don't know. I would suggest Sujit Pal sir to just take over until I just contact with Zafar sir. Sujit Pal sir, just take over this situation. Let me just tackle Zafar sir until then.
Zafar was talking about some kidney stone. So I want to just tell some precautionary measure for the stone, which is very much necessary. After taking the medicine very frequently, or the patient who suffer from the very frequently they suffer from the kidney stone. They should avoid the things like milk or any milk, along with the vegetables like palak or spinach. We should avoid all those things which causes very. Hello, am I audible?
Yes, sir. You are
Which
audible, sir.
causes
You are audible.
which causes very frequent kidney stone. Even we should avoid the non-vegetarian like especially mutton, which to some extent we can consider chicken or fish, but mutton is strictly prohibited. Those who are very recurrent. Along with that, commodities also should be restricted, which causes very frequent kidney stone. Along with that, today nowadays very frequently the doctors examine about the calcium level, tell the D3 level come, D2 level come, and they give the calcium supplement, which is very we observe that which causes the kidney stone. So along with the routine treatment, what the Zafar was talking about, Barbaris vulgaris or lycopodium, along with that homeopathic medicine, or very frequently we take the medicine like sarsaparilla, lycopodium, Barbaris vulgaris, even very acute pain, especially on the left sided colic pain in the abdomen or colic pain in the general region, especially on the left side. Very frequently we think about the Kurusi, or on the right sided, think about the neck nose. Or even we give the medicine of Valveric vulgaris or hydrangea. So along with that, these are the common homeopathic medicine. I just routinely we should advise all the patients to avoid all such things. Otherwise, even after taking the medicine, also the stone will recur very frequently, or every time it will recur. One of the very frequently in case of kidney stone or calculus, many patients, bedridden patients, very those who are having a long time catheterization. At the end of the catheter, sometimes there is a calcium deposit, or due to which very frequently there is a infection, and because of which the patient suffer from the body fluctuation. In such cases, suffering from calculus or calcium deposit, or along with infection, in such cases, Uva Tulsi is a good medicine. I can add what Zafar was telling. Along with that, I can add this about the kidney stone their precaution. Shall Jafar continue, or I can continue for some more time? Jafar is audible. Okay, okay. Jafar was telling about the cases of alopecia. Alopecia. I want to add some more medicine about alopecia. Uh, he was talking about the case of alopecia. So, in case of alopecia, we have seen that there are many medicine which we very not uncommon or very rarely we use. One of the very rare used medicine is Helium metallic, Helium metallica. Especially, this medicine can be given when the patient suffer from some exhaustive diseases. Exhaustive diseases. Many times it happens that because of after suffering for so many days or after some very exhaustive diseases, it was a very good example that the patient suffer of post-COVID. There's a common symptoms of which is along with that, if the patient having the complaint of hair loss or any exhaustive diseases like a patient suffer from typhoid fever or a patient suffer from any viral fever for a long days or any other disease after suffering from suffering from disease for a long time. If the complaint came from the patient that there is a loss of hair, then the Metallica, earlier Metallica can be resolved. One more medicine for alopecia, Sentinella. Sentinella. Especially Sentinella. It is also a good medicine for the alopecia. The patient, especially the female during their puberty or during the pubertal period, if there is a loss of hair, complaint of loss of hair during the puberty or during the menopausal period, usually the complication during the puberty or the complication during the if the patient is depressed due to which they are suffering because of that, if there is a loss of hair, if there is a falling of hair, so this medicine is a very good indication with depression. But in Alien Metallica, which I told previously, it is without depression, Alien Metallica, and with depression, having the complaint of during the puberty or during the menopausal period, with that, with, with depression, Stabilize it. Very good medicine. So these two medicines, which are very not commonly used medicine during the alopecia. One more very common medicine, Victa minora, which used very frequently for the alopecia. I just add some medicine which what Japan says about the case. This is another medicine. Very Victa minora is a very common medicine for the alopecia. Or it's a very good medicine, very commonly used medicine. There's a bandage, there's a patches around the head, on the scalp, where there's a oozing, where there's a itching, followed by oozing, and because of which the hair becomes ragged and hair falls down. It's a very good indication of Hidra Vaidara in case of alopecia. Very common medicine and very frequently we use the uric acid in case of alopecia, especially the person of premature old age. Very frequently we use. Uh, One more medicine, very common medicine. is used for the pulling of hair, for the alopecia, arnica, and jabrandi. We can use internal as well as externally also we can use jabrandi along with the picture, along with the mix with the coconut oil and we apply on jabrandi. There's a very hair fall with dandruff. And if we use externally along with the mother tincture, we mix with coconut oil. It's a very good thing. Cyanothus in boring it is written that Cyanothus is a medicine we can apply for a hair tonic, or in case of loss of hair, we can use along with that is also can be used Cyanothus mother tincture along with mixed with the coconut. This can also be used in the extent. These are some what Chakur says about the case of alopecia and other kidney stone. These are few things I added with Chakur. Sorry, audible.
Sujit sir, you just continue, sir. You just continue. Maybe Zafar sir is in the backstage, but maybe he can't hear from us, or we can't hear from them. Hear from him. So you just continue, sir, if possible. You just take over, sir.
Okay, he's not audible.
Yes, sir. He is not audible for now. Maybe you just tell Zafar sir to just talk. Maybe there are some background noises from him, like the horns. Maybe he is audible. Maybe he isn't speaking for some reason. I don't know. Maybe he can't be able to hear from us. He's unable to hear from us, I guess.
Yeah, I am hearing you, all of you.
Hey, Taito. Zafar sir, over to you, sir.
Continue, sir. Continue.
Okay, okay. I am
Okay, continue,
now
Dr. Jafar.
I am yeah, I am now starting a case of breast cancer. This breast cancer is mainly it is in my chamber. Many women are coming with a case of breast cancer. And this breast cancer was treated by so many medicines as Bediega, Carboanimalis, Maxol, Phytolacca, Conium Mac, Silicea, Bufo, Graphitis, Asteria rubens. But there are some differentiation between the selection of the homeopathic medicine. I am saying the Bediega. If you apply the Bediega, there are certain symptoms which distinguish from the other medicine. In case of Bediega, when the skin is so to touch, axilla gland enlarge and is sensitive to cold and touch. Bediega is a wonderful remedy. Similarly, carboanimalis, when there are indurated borders of ulcerated cancer or fistulous opening, stinging, burning, lancinating pain, and sensitiveness to cold air, it is a specific remedy for breast cancer, carboanimalis. I have already given the carboanimalis and treated the breast cancer. Similarly, Moxol, a very great remedy for breast cancer. When mammary gland is in suppurative stage with yellowish or greenish discharge, stinging pain, axilla glands enlarged. I have a medicine like Phytolacca. Phytolacca was given even a single dose of Phytolacca 200 disperses the tumor. It is also indicated in ulcerative cancer of fistulas type with watery, fetid discharge, skin purplish, mamma hard, and sensitive nipple ulcerated. But there are nipple ulcerated, there are various medicine, aurum, iodum, castor, conium maculatum, graphitis, hipersal, nitric acid, phytolacca, ratania, silicea, sepia, and various medicines. Similarly, when there is extensively used for malignant affection of the gland, heart tumor in mamma with piercing pain, aggravation at night, shrivel mammary with increased sexual desire, breast enlarge and become painful before and during menses, you can think about a medicine like phonium. If given in time, it will avoid abscess of breast. As Ken says, fistulous ulcer of the breast with watery offensive discharge, you may think of silicea. Similarly, you have to use Bufo strictus, which is palliative in cancer of mammary, induration, burning, congestive headache on vertex with filling of weight are prominent symptoms. Like graphitis, graphitis, the swelling, induration, cracked nipples, constipation in ulcerative cancer, the discharge is sticky, nipple is involved with crust and crack. We should apply graphitis. Similarly, a medicine very important, that is Asteria rubens. Very important. I have applied in many cases. That is indicated in ulcerated cancer of mammary with fascinating pain or pain in left breast as if put it inward or pain extending to arm up to little finger or left side. Axillary gland swollen, hard, and knotted. Pain often aggravated at night. There are also various medicine for breast cancer, that is hydrosis canadensis, also carcinoma, carcinosin, arsenic iode, plumbum iode. These are all medicines for the breast cancer. So it is my experience that I have applied carboanomalies, Asteria rubens, and conium mag for the breast cancer, and I have a wonderful result in my area. That is very important for me, and that is my best clinical experience in my practice of 26 years. Thank you.
Sir, over to you, Sujit Pal sir. Zafar sir has
Uh,
completed his session.
yeah.
Thank you, Dr.
Sujit
Jafar.
Pal sir, over to you, sir. Hello, sir. Sir, over to you, sir. Over to you.
Okay, okay. Thank you, Dr. Jafar, for giving a good picture about some medicine. medicine of breast cancer, Carbo animal is very good medicine. Carbo animal is actually a students. And other medicine will not solve the other. All those medicine we are trying to explain. Breast next, hello. Hello.
Sujit,
Ah,
please conclude. You means you please moderate.
Suvendu.
Dr. Sujit,
Follow.
Dr. Jafar's speech is over. If you can hear us, please moderate.
बोलना वो तो देखिए
Dr. Sujit,
हाँ, नहीं वो तो जाए इसके ऊपर कमेंट जाए already already it is over.
okay, I'm checking for the comments.
हाँ,
Also, please bring on Dr. Kalyani, sir, to conclude. Also,
Thank you, thank you, Professor Sujit Pal for moderation, and thank you, Zafar, giving his clinical experiences nicely. Equally, thanks to our Inaugurator, Tanmay Bhattacharyya, for inaugurating today's session. This 112 CME is a landmark of our CMEs, because this is for the first time in the history of CME of Alumni Association. The director of NIH of his own has come forward to encourage us, to inspire us. It's a grand good news and a recordable incident. Never this happened before. So anyway, today's there was different type of disturbances, but always I believe that in spite of all constraints, homeopathy is facing since its inception, starting from Hahnemann. We are habituated to the facing with constraints, different type of constraints. Still, we are proceeding, we'll proceed, we'll learn gradually. Because we are having today a little bit time and we are talking about the clinical experiences, let me utilize the time by telling you some experience of NIH. All or any of the alumnus of NIH having number of clinical experiences, and they are backs and backs of experiences, innumerable numbers, because the fertile soil of NIH OPD is rarely available in the world. We all have seen various type of cases. We have seen treatment, cure by our teachers, by our own, by our seniors. So all of us having number of experiences, our request to come forward with their own experiences and their experiences in the student life, internship or post-graduation. What I like to share today, that my experience with my teachers, who has blessed us, who has helped a lot for development of NIH students, their knowledges, our teachers. Let me share. Many of you might be knowing, maybe one or two cases are repetition, because I am highly encouraged by their participations. First, let me tell you about Dr. N.M. Banerjee. Those who are deep in NIH and early stages of B.H.M.S, they know him very well. A tremendous respectful person, very tall, with white dresses, good than your dhoti, never used to wear any pant or shirt. Neil Madhav Banerjee, the famous radiologist, was one superintendent of SSK Medical College. He was so happy by the action of homeopathy. He used to come to our OPD regularly to see our cases, X-ray, and he was a godly person. My experience with him, first is, he was convinced not only by seeing the students coming from all over India, but by seeing the efficacy of homeopathy. Very frequently, he used to take homeopathic medicines from us, especially Dr. Samuel Day. He was my colleague. He was very close to him since beginning from Amma Street. Whenever he feels difficulty at his home, his child son of his own family member, he used to talk to us and used to take medicines from us. See our blessings that our teachers of that rank, superintendent of PG hospital, postgraduate hospital, he is taking homeopathic medicine for them, telling us that we know the action and reactions of our medicine. There are difficulties by modern medicine. So homeopathy is a safe, cold, and no risk, easy to consume. Frequently, he used to carry homeopathic medicines by telling us his complaints from our OPD. One case I can tell his experiences. One day, one of my very close family member, I took her to him with ultrasonography, X-ray, all the reports for the complaints that right iliac fossa pain is persisting, not getting relief by any medicines. But typical appendicitis complaints, that is rebound tenderness, reflex tenderness, psoas test was not that much positive, but almost daily he is complaining of pain, exactly on the point we find for appendicitis, McBurney's point. Then ultimately we took the patient, my family member, to Professor N.M. Banerjee. By listening his her complaint and then by seeing his report, her report, he immediately throws all the reports and accepts on the ground and became very annoyed. You have brought this patient for us, our help. Treat of your own. It is best case for you, not for us. It is not a case of typical appendicitis. Try yourself. I tried my level best, but absolutely failed. Not only for months, but for years together. Ultimately, not getting relief, had consulted with many other surgeons, including great surgeons of Kolkata, Subrata Banerjee, you might be knowing, famous surgeon of Kolkata. Then ultimately, we went to my teacher, that is S. Banerjee, Sujit Banerjee of Calcutta Homeopathic Medical College. For a few days, he came NH also for his suggestion. He saw her clearly, sincerely, and then called, this is not a case of appendicitis, this is a case of tipulitis. That means cecum, appendix, and colon. All three things has been involved. That's why this type of pain. This is like ulcer of street dogs, ulcer of skin of street dog. It will come and go, and it is very difficult to cure. I can operate the appendix, but I think the complex will sustain. I came back, complex continuing. You know that any of the family members, she goes on suffering, then you won't be able to be quiet. Ultimately, I agreed to operate the case. I took my family member to Dr. Gopal Dave. At that time, he was teacher of NI surgery. And Dr. Gopal Dave was assisted by our very close friend. Later, he became principal of DND Medical College, Dr. Bhukti Padodhikari. They operated the appendix. But after 1 or 2 months, when the medication was completed, again the same complaint started coming. I was very much disturbed. Then decided to give anti-miasmatic drug, and I prescribed only on 200. Patients started improving. Just to come to a conclusion that anti-miasmatic drugs should be given in refused cases or the cases are not getting cured. It took years to get the time and harassment like anything, moving from one doctor to that doctor. So I want to tell that, see the vision of Dr. N.M. Banerjee, that it is your case, not of us. That means when they asked him after getting recovery from Thuja, how did you conclude it so firmly and became so annoyed? You throw all the reports on the ground. He told, see, once there is no specific cause, once there is no specific pathology, and once there is no specific drug, allopathy is constrained, handicapped. Simply trial and error will create more money, many more diseases than curing the disease. That was his realization, my experience. Then let us come to another teacher, Dr. D. Pal. Many of you might be knowing his name. He used to come many days in Salt Lake N.H. also. Such a godly person. He used to wear a simple half shirt, ordinary pant, and one umbrella on his hand, like Dr. N.M. Banerjee, every day. And he was such a teacher that he taught only two diseases, one diabetes and another anemia in deep N.H. course in 2 years. First year he taught anemia, second year he taught diabetes, and entire practice of medicine was covered by these two diseases by DD, differential diagnosis. Such was his talent. He also used to take homeopathy medicine from many of our teachers, from us, and Dr. Suvendu, knowing his name, was very close. He used to give him medicine whenever required. In the latter life, I had the good luck to get his blessing to start by providing homeopathy medicine at home. So such a brilliant scholar, such a brilliant teacher were inspiring us to practice homeopathy on their own. See their confidence, see their love on the system. Another experience. One day, Professor R.P. Mundal, probably, if I am wrong, I may be exclude his name, famous dentist, very beloved, fantastic person, R.P. Mundal, dentist. He used to come in OPD regularly. One day, he told me, see, Dr. Kalyani, I am suffering from a trouble with my daughter. I may be please excused that these things are my experience simply to inspire my fellow friends and to pay homage, respect to my teachers, Dr. Mundal, for giving us the chance to gain our experiences. So Professor Mundal one day in OPD, he told, I am facing one problem that my daughter is weeping almost entire day for a few weeks. I'm not able to understand. She has no shock, no strain, fantastic daughter, but this coming out of tears is not being controlled. Can you help us? I asked him to bring once. He brought her. When the daughter is coming with his father in our cubicle, I saw the ladies weeping. Tears are coming out from the eyes. But the facial expression is unchanged, fresh like anything, teenager as it seems to be, but uncontrolled tearing from both the eyes. He's swiping the tears. By saying this and the age, it is very clear any of us will be able to prescribe pulsatilla. I prescribed pulsatilla. Then Mondal told he was so fond, so beloved, so grateful that he used to study homeopathy. He told, I was thinking to give pulsatilla, but I was not very sure. Unknown cause of this tearing. In pulsatilla it is written, the tears come easily, but continuous I could not conclude. Thank you, Colin, I will give it. And he gave 200 pulsatilla. Tearing stopped. See the beauty. The mental symptom became a physical symptom to a daughter, and the dentist inspired us and gave us the chance to gain our experiences with our daughter by homeopathic medicines. See how much love they have provided to us, to N.H. and our friends and brothers. Another case. One day, I had the fortune, good luck, that my duty was in the room where medicine specialist Professor Somers, they used to come twice or thrice a week. Whenever he will come in the OPD and he finds any case, either in the OPD or in the IPD, he will immediately search where Dr. Kalyani is. And student will call me. If I am not there, he will call me, sir is calling you. And I used to run to him because he was not only called to be, but I have experienced he is really movable encyclopedia of medicine. He was called to be in National Medical College, that moving encyclopedia of medicine. Any moment, anything you ask, without a single minute, he will reply. And whenever he will call me, I used to go with the students. He will start taking the class with the patient, whether scheduled or non-scheduled, and continue with differential diagnosis. Nobody knows when the class will be ended. He used to love us so much. That person told me one day, Kalyani, my daughter is suffering seriously. She's admitted in hospital, but not getting relief of pain abdomen. Then I asked him, sir, what are the conditions and what are the symptoms, as we ask usually. Then I asked him, sir, can you help me one thing? Then I can try to help you. Then you ask him, what is anything which gets to some extent relief? And his daughter was a doctor. He was admitted with the pain, just imagine. And he told that doctor's team has decided to laparotomy, to open the abdomen to see what is inside. The next one day after, when he came in the OPD, he told one complaint he has told that the pain gets relieved by pressure. He bent forward. These symptoms are not being that much encouraged by conventional system of medicine, but it is of great use to us. You know, all of us, the drug is only one plain simple drug. Colocin, I gave her 6 from OPD. He took it, and the next day he came. He did not have the OPD on that day. He came and called me. What was the drug? How it gives so quick, fantastic improvement. The pain has stopped since last night by giving a few globules. See the affection, love, and good luck getting the chances to treat family members of such a doctor. Patient is doctor, his father is Professor Somers, they living encyclopedia. Later one day, before the students, he is telling one day that I am scared of your globules. Whenever he is to take any medicine from us, he will ask, how many globules? If I tell 4, he won't take 3 or 5. He will count 1, 2, 3, 4, he will take it. Then one day I told him, sir, 1, 2 globules is no matter, you can take it. No, I am afraid of your globules. This very language. I have seen the efficacy of number of globules. This is one instance. Another instance, since then, he started taking homeopathic medicines for his family members, and I was blessed by him. He used to call me at his home also, and several times I had lunch with him. So affection I got from him. One day, he seems to be very morose, OPD. I have never seen such type of depressed facial attitude of Professor Somers there. I asked him, sir, is there any complaint, difficulties? No, not that much. I am very much worried. What happened? My retina has started bleeding. I was shocked. So you have to consult with the orthopedic ophthalmologist. Yes, I consult with my students, with my colleagues. But the conclusion is, it is very difficult to be controlled because of suffering persistent thumb complaint and COPD. He was a chain smoker. I know what is the fate. I am going to be blind since within a very short period. Nothing will happen. I was also very much depressed. Then he told, can you do something? Then I told, sir, I will, let me think. So I asked him the pathology behind. He told me that gradually, progressively detaching retina by bleeding, very difficult to control. Then I remembered his lifestyle. Let me tell you the right lifestyle to have a very firm confidence on the drug. Sometimes when he was very casual, he used to tell few incidences of his own life, referring to the patient situation. He would see a patient, then gradually refer his early life, student life, childhood, family members, village life. He is a person of medicine from the ground level. He will start medicine from the ecology, geology, sociology, then he will come to the practice of medicine, such type of person. So he used to tell us some his personal life experiences. One of them is, I asked him, sir, are you still smoking? He told, no, I have stopped it. I was not knowing. He has stopped it, very nice. Sir. Then he told, I decided that once someone can start smoking within a day, why he will not be able to leave it within a day? The moment I decided I stop it, I have never taken a single puff since few days. This is one incident of his firmness, his conquering attitude. Then frequently he will tell, someone is a very simple person. When he is a doctor, he is very generous, very grateful, very helpful, very polite. But when he is angry, he becomes furious. Second incident. Third is, he told once, not sequentially, that once we are traveling by bus, two of our friends were there, myself and my friend. By some casual affairs, contractor gave us slang languages. And we could not reply because we are doctors. We became sicky. But after coming on from the bus, we decided that we are the first class citizen. We could not reply him. We could not stop telling these type of languages. Okay. We will teach him. He was a student of medical college. He collected his friend and went to a remote village and find out a very old widow who used to give infrequent slang languages. Then both the friends requested that woman, please tell grandma from bad languages. We want to learn from you. He became shaky. You are doctors coming from Kolkata, you want this thing? Baba, maaf kar do. I won't be able to tell you these things. We are poor persons. We are suffering. That's why this type of languages come. This is not for you. Please take water, batasa, sweets, and go. I won't be able to tell you a single word. Then they didn't reply. They didn't return. They returned back from the home. That was thatched home, hut. Then started throwing stones on its grass-made roof of the thatched hut. Then that woman from the home itself became angry. She was not knowing that these two doctors are throwing stones. He started giving slang languages from the home. Whenever she came out, they hide it themselves. Likewise, about 1 more hours, they heard different types of slang languages. Came back to Kolkata and waiting for the conductor. Once they found that bus is coming, got up the bus and did the same thing what happened on that day, previous day. The moment contractor replied uglily, badly, immediately they started giving those languages learned from the old woman. And that contractor becomes startled. Then they told, remember, if we heard this type of language in this route, call us it. We will not leave you. Don't think that because we are doctors, you don't know anything. Doctors can know anything and everything at any moment if they want, which you cannot. See the conquering attitude. This type of few incidents, I heard it before. Then I thought at night that such type of doctor, homeopathy can't help him. I was brooding over, because we all know that whenever there is some serious physical complaint, care less for physical symptom, give more attention to the mental symptom. I decided he's a person of conquering attitude, never bows down mentally or physically throughout his life. I decided to give him Naxmaker. Next day, when he came with same type of appearance, I asked him, sir, please take this medicine, Naxmaker 6, twice a day. Let us see. He very sincerely took the medicine and started continuing. Next day, he could not come. Maybe it was some other reasons. Next week, when he came, he told, I checked my retina and the bleeding has stopped. I was so much encouraged, I won't be able to tell you. That's high type of teachers taking homeopathy medicine, encouraging us and telling bleeding has stopped from retina by radioscopic examination. When I asked the teacher, I was afraid, because I have heard that even some serious pathological disease, a minimum single dose repetition may be extra, may cause some harm. I asked him to stop the medicine. He refused. I won't stop to take the medicine, because I have seen the continuous bleeding could not be controlled by anything. Is being controlled by the homeopathy. I won't leave the medicine. I will continue. I will let me see what happens. That type of personality never listened to anybody without any logic. He started continuing. Next week came that my bleeded area has reduced. Every week he used to check the retina and telling improving. Ultimately, that dark rings around your inside the retina, visual rings, dark spots, gradually started reducing. And after 2 months, he told me, my eyes are completely normal. See, such type of drug is Naxmaker, and such type of mental symptom is of Naxmaker. Any age, any person, any status, any education, when he's of that attitude, never bows down to any situation, especially mentally, it is Naxmaker. Then let me tell you another incident of one of our teacher. Another incident. Madam, means Mrs. Professor Day, was suffering from arthritis, knees. He was under treatment. He was controlled, but movement became restricted. He directly told me that I know the fate of the disease, but please give me your drug. I went at his home. He called me, and medicine was given, and striking improvement started. He used to take homeopathy medicine so sincerely, you won't be able to believe. When I went to his home, I found he's a very big chamber. Homeopathy medicines are kept on the cupboard, very clear place, very sincerely, not very casually, because it is free and homeopathic medicine. His father is, one son is cardiologist, one daughter is gynecologist, other daughter is doctor. Such a family used to take homeopathy medicine. Such good luck of homeopathy, N.H. and us. Likewise, exactly I am not able to remember. If I remember, I will tell you later on. In different cases, many times we have seen that our teachers used to take homeopathy medicine in various times by various teachers, and most of the teachers of NIH from the conventional seat of medicine, NIH in Amar Street number was more in Salt Lake. Almost all of the teachers were so fond of homeopathy They used to not only love, but also ready to pay respect for the medicine, the system. Many of them were very minimum, with very minimum honorarium. Many of them did not approach for the honorarium like someone. They never went to account department for taking the check. If anybody hand over the check at OPD, he will take, otherwise he won't tell anything. So this type of experiences in NIH, many of you are having many more. One more case, I just remembered. One director, I don't want to tell his name now. During my latter period, one of his relative, a lady, he was having pain, severe pain, infrequent pain, not being controlled by conventional system of medicine, pain in abdomen, non-specific pain in abdomen. He asked me, Dr. Kalyani, please see the case. She was admitted. Director's case was cared seriously, and I was very much rather nervous that director has given the responsibility to treat this lady. It's not a matter of joke. I have to cure the patient because definitely he want to know my skill. So I observed for 3 days frequently. Whenever I'm going, seeing that lady, I'm seeing ladies who all right. Sometimes I'm leaving the ladies covered and he's off. He's covered. I asked him, do you have the pain now? Yes, severe pain now. Why you're offing the fan and putting covers? I'm feeling chilly. This I confirmed for 3 days. I became sure the patient is pulsatilla. You all know, pulsatilla was given and marvelous improvement. Within 2-3 days, he became perfectly all right and he was discharged within a week by relieving the pain which was suffering for months together. Another case of our director, Dr. N.H.M. না একটু রাতে করুন তো 1/2 ঘন্টা পরে। One patient in OPD came with ulceration of mouth, tongue, buccal cavity, severe ulceration. Sir took the case and referred to me. Kalyani, take the case history. I took the case history and I found the case is marked short. Not very critical case, simple marked short, common symptoms. Then I referred the case to sir. He gave marked short, 10 ml, 1 dose, and asked the patient to come after 1 month. The patient did not took the medicine from OPD. He took it from outside and he understood and he saw the prescription, the dispenser, means that shopkeeper, medicine shopkeeper. He gave marked salt, the same potency, 1 drum, and he started taking marked salt 10 ml. He started taking every day. He understood that not 1 dose, 1 dose every day. He continued for 1 month. Marked salt 1 ml, marked salt 10 ml every day. Next month when he came, ours is completely vanished. Then Professor Chakraborty told, see the beauty. Homeopathy is equally efficient in single dose and multiple doses. At that time, LM potential was not much, we are not much habituated. And he told, see, single dose, the first dose is the medicine started working and cured the case. Later doses became like placebo, could not do anything. Single dose has cured, rest of the dose was unnecessary repetition due to ignorance of the patient. Likewise, there are a number of experiences from our pathologist, Dr. Tanmay Bhattacharyya. I just remember. Bhattacharya, famous pathologist. He used to take homeopathy medicine from our colleague, Dr. Samuel Lace, who was very close to him, for his family members. Likewise, we are very much grateful. We are blessed by our teachers to give us chances to experiment homeopathy medicines on the famous doctors, conventional system of medicine. And we have number of cases of our homeopathic doctors, homeopathic faculties, teachers. Many of you might be knowing, but we are equally successful to treat persons, family members of any system of medicine. So today is a great day, I told you. And this type of experiences is very much required to encourage, to be inspired, to treat, to depend on homeopathy medicines. If I get chance, I will tell you later on other experiences. With this, thank you for the day. Thank you very much. Bidyut, please.
Good evening, sir. Uh, with this, we are closing our CME tonight with an announcement that our next program before the CME, we request all the alumni to be present in the NIH campus to felicitate our beloved alumnus, the new appointed director in charge, on 17th of April at 2 p.m. NIH Alumni Association will be felicitating our new director in charge, Dr. Pralay Sharma, sir, on 17th of April, March at 2 p.m. in NIH campus in the ground.
Good.
So we request all the alumni across the country and those who are staying near NIH, please be there and make this program a grand success. With this, I'm returning with the permission of Kalyani sir to our backstage editor, Dr. Mukherjee.
Sure. Thank you very much.
Over to you, Orko.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, just do make sure to give it a like, share, and subscribe. And today's CME, we are not keeping any certificates because there are some technical glitches with the certificate issues. That means there are some technical glitches in the certificate thing, which we are facing some complaint, and we are trying to get back soon with that. I hope just see the CME and enjoy it. Just do whatever you like, and also remember that one thing, that today is the final. And so with this, good night and watch the cricket's final today and see India win. So with this, it's me, Dr. Orko Mukherjee. See you in our next CME. Until then, good night. Subratri.